Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education.
Welcome to 2024, buddy. First one for the year.
I was literally going to say the same thing.
There you go. Well, we're like one person.
How are you?
I'm good. I'm good.
Did you have
How
a
are
nice
you?
Christmas? Yeah.
I did. It was very relaxed. I stayed in Sydney, spent time with the family, enjoyed Sydney roads without mountains of traffic.
Yeah.
It was nice. What about you? You were all over the place.
Yeah. Oh, look, London was nice. Saw family,
Yep.
touch base with a few people, but it was, miserable cold. So
Yes.
nice to sort of get out there and get some sunshine. And we stopped off in Dubai on our way home. But it was great. Kids loved it. And we're back.
Yeah. And
Back
hey-
into the swing of things.
So today, for the first episode of 2024, we are joined by Nadia Zanco, who is one of our very special and I guess one of the most contributing, is that a word? Contributing, or one of the biggest contributors in our private WhatsApp groups as part of our Patreon community. And Nadia is a clinical nurse specialist with a background in psychology. And this conversation was spawned off a Patreon piece of content that we were recording together last week only, talking about how to understand patient psychology, how do you do a consult, what is the patient mindset that's coming in to undergo some of these cosmetic treatments. We covered things like conflict resolution, but we only did it in sort of a small snippet. And I thought, wow, this would be a great piece of content to share with the entire IA community. Hence, asking Nadia to come back and join us for a full-fledged episode. So I think it's a great way to start off 2024 with a bit of psychology and getting in the right frame of mind for the year ahead.
Yeah, and it's exciting for me because this is completely unplanned. I got off a plane about 4 days ago and I saw your content. I thought that was awesome. So yes, let's see where this one goes. Normally we have a script and a bit of a story for our podcast, but we're just going to go for it on this one.
Well, we've got some key points.
Yeah, that's true.
Yes.
So let's introduce Nadia. Nadia, tell everyone where you're based and your background because you're unusual. You don't inject, but you're part of our community and you do contribute a lot. And I know you know a lot about skin and, of course, psychology. So, sell yourself to the listeners and tell them why you're part of our community and what you do.
Good morning, first of all, both Jake and David. And this is really unfair. I have the inaugural 2024 meeting. How high could you set the bar for me on this one? Really?
Well, everyone's still sort of on Christmas time, so you might be okay. You might be all right.
Please be gentle with me. Okay. Who am I? What do I do? Okay, I work in Bathurst. I to be honest with you, I started out in nursing in the 80s. Let's just leave it at that. In Broken Hill, did a lot of the RFDS work. So for those, international guys, the Royal Flying Doctor Service. So yes, I was the crazy nurse with the little birds, ventilator in my hand, running up the road, putting people together again. So that is where I started out. Let's shorten that story by a couple of decades. Yes, I got into, first degree was actually sociology, and then into psychotherapy and that sort of thing, got into mental health, started a private practice in Sydney in Bondi Junction with an incredible woman called Greta Goldberg, who probably was the person who taught me about business. And we can circle back to that a bit. Then that practice moved over to Darlinghurst, and it was the AIDS era. So there was a lot of stuff going on, if you can remember, Sydney, New York, all of that, Silicon Valley, a lot of those people were coming home. The AIDS era hit hard in Australia, as it did the world. Then I left Sydney because of a horse. Most people think you leave Sydney because of a lover. No, well, she was my lover. I left Sydney because of a horse. She hated Centennial Park, so I moved her out to Bathurst. My business partner, who is a psychiatrist, had a practice here in Bathurst, so I joined that practice. 20, 30 years later, we now have a massive practice in psychiatry in Bathurst. But what I started to think about a decade ago was what happens when people hit their 50s and 60s. There's this massive dive, and we know there's a massive dive back into depression, back into even suicidality. Suicide rates go up phenomenally. And so my thinking was, what in God's name's going on? And as I started to ask people more and more about, like, what is really going on? You've been a high-functioning individual all your life. And they would start to talk about, in loose ways, their aesthetic. People think I'm always angry. People think I'm always unhappy. I can't get the jobs that I used to get because I'm always perceived as angry. But I'm not angry. This is just me. So I started to think, well,
is that the colloquial term for that resting bitch face?
Well, yeah, I think it is. I mean, the Americans who coined a term for everything call it the wolf look. And if you think about a wolf,
Wow.
It gets angry. Everything pulls forward. Jake will know this very, very well. The jaw changes, the cheeks hollow. So you get that real wolf angry look. The glabella gets really heavy. The eyebrows slide in. So women especially, do start to look like an angry wolf. And if you're sitting at a panel, who in God's name's going to, employ the wolf in the room? They want the happy face. So women especially were really struggling with this. And I was seeing women from, the banking industry, in Darlinghurst, and because that's where all of this came from. So, we're talking about Silicon Valley people, we're talking about lawyers that were working, international law. And they were all saying a very similar thing. I can't get a job. Something bad is going on. I am being overlooked. I have the skills, I have the experience, but I'm being overlooked. What's going on? So that prompted a study more in terms of morphology of aging. What is going on? So that's how my journey in aesthetics started out. And I figured at that point, you know what, there's no point my trying to be the master of everything. Injecting just seemed like a world where, that is a skill in itself. And I keep coming back to this. It's not just a part of medicine. It's actually a part of, like, psychiatry. Injecting is actually an art and a science. As psychiatry is exactly the same. It's an art and it's a science. And it's not something that you can learn out of a book. You really need good mentors. And that's what I love about you guys. Jake especially, you have mentor days. You have, you're teaching. And I think that's how the cosmetic industry evolves. And it's very, very similar to psychiatry, because you can't teach psychiatry out of a book either. You've actually got to be at the coalface and learn it hands-on.
That's so interesting.
So that's how my journey started.
Yeah. For some geography for the people who don't understand. So Bathurst is pretty regional.
Yeah.
New South Wales, the same state as us, but far out west.
So
250K. Yeah. So I'm the other side of the Blue Mountains to you guys.
Yeah. So it takes about, I have a friend that lives in Mount Victoria. So I live in eastern suburbs of Sydney. So it would take me about 1.5 to 2 hours to get to Mount Victoria. And then it's probably another, hour and a half?
Hour?
Yeah.
Yep.
Past then. Yeah, west.
Yeah. And tell us about your clinic, because even today, as we were having a sort of a pre-chat, but before this podcast, I understood that there was a dovetailing of your types of patients, the psychology patients and the mental health, with your aesthetic doctors. But you said that's not so common. So how does your clinic run?
There's a minor cohort that switches over. So the cohort is our younger people who our psychiatrists might see who have skin disorders. So the predominant disorder would be acne, and I'm talking grade 2, 3, maybe even, a low grade 4 acne. So they're fairly severe acne. Now, the interesting thing about acne, as you would already know, acne, when it starts early on, it impacts the brain and starts to shape the brain in a way that creates a depressed form in the brain. So depression and anxiety jump up to about 35% in that cohort alone. And if we don't treat that, so we can treat the depressive side of it, or at least we can try it, but we don't actually get a positive result in our treatment unless we actually treat the skin condition. So I started to look at, well, how in God's name do you treat acne? Like, all these kids are coming in, it knocks about their schooling, it knocks around their relationships, it then knocks about their employment opportunities. So we're just hitting the same stick again. What is going on, and how do we help people get past all of these things? So that's really the only cohort that crosses over until we get to women in their perimenopause, and they're starting to ask the same question. I'm not angry. This is just how I look. What can happen? And my antidepressants are not necessarily cutting the mustard anymore. So with our psychotherapy practice, it's a massive practice because we're one of the few practices that cover pretty much most of Australia. We have a little aircraft that we tend to go out to various communities, cover those communities occasionally. So our practice in psychiatry has about 10,000 people on its books. We have about 840 GPs referring in. We cover the lower end of Queensland, some of Western Australia, a lot of ACT. So it's a big practice. In terms of our skin clinic has about 1,500 people on it. I cannot see anywhere near all of those people because I only do 3 days a week. Sean Walsh, we're very lucky to have him coming out to our clinic to do our injectables. He would run a clinic Friday night and all day Saturday, so we could do a 12-hour day on Saturday and maybe 4 hours on a Friday afternoon every month, and we still don't get through everybody.
Yeah.
So they're big practices for small areas.
I've been trying to twist David's arm to get an IA aeroplane, but we haven't quite got the budget for that yet. But one day.
Well, an aircraft's about the same. I was thinking this morning. An aircraft's about the same as a really expensive laser. So, ditch the laser idea, buy yourself an aircraft.
Yeah. All right, let's do it. Let's do it. So I actually wanted to touch on something because it was such a relevant point. You said about acne, how it affects the mental health, and to improve the mental health, you kind of have to treat the acne. So clearly the cosmetic or the aesthetic dovetails into the mental health. So I think we all accept that's very obvious. But sometimes when we think of aesthetics like injecting, obviously there is a crossover. Patients have a motivation to come, whatever it is. But then also we have this big dynamic, and it's particularly relevant because of the new regulations here in Australia that we have to screen people for mental health. And we're almost told if they have any type of mental health red flag, let alone body dysmorphia, we should be hands off and give them to someone else. So
who would you like to give them to?
Yeah, well, exactly. Who do you send them to? But also it's a tricky thing to navigate because sometimes, and I've got to be very careful with how I say this, sometimes the aesthetic will help the mental health. And I've got to...
Why do you have to be careful?
Well, because I don't want people sitting or listening to this thinking I'm saying Botox makes you feel happy.
Well, I don't think it's quite as...
And fillers are necessary for making you feel better.
Yeah.
Sometimes that is true and sometimes that is very bad.
Yeah.
And maybe Nadia can touch on, what is the boundary of those two?
Yeah. I mean, I think that's potentially a little bit of a reductionist perspective on it because I think there is truth to that. I mean, I was going to say, Nadia...
I'm only being careful because I'm a doctor and people will quote me and say, Jake said this.
I mean, what you were saying, Nadia, about ladies going in for an interview and having that wolf look, I mean, could it potentially be like this positive feedback loop where you actually don't feel that way about yourself, but because people's perception of you is like that, you start to think that, and then you actually start to become your thoughts. And then it starts to create this vicious cycle. So I think there is a lot of merit that perhaps a physical presentation can actually then start to shape the mind, even if that wasn't how your mind was starting to begin with.
That is true, because all of my patients tell me that. And even if it's inappropriate to treat, they will still voice, I want a treatment because it will make me feel better.
Yeah.
And that's my job to try and tease out, well, when is it appropriate and when is it not?
But it's like everything in life. I mean, everything's a matter of degree. If you drink too much water, it's bad for you. If you exercise too much, it is bad for you. So, I mean, if you have too much, if you go to that point where you actually start to become obsessive and start to become body dysmorphic, is it the treatment's problem, or is it the fact that maybe the practitioner hasn't been skilled enough to identify when is too much, or what do you think, Nadia? Let's unpack this a bit because it's getting a bit complicated for me. My brain's hurting.
Okay. You both of you bring really important points to the table. I'm going to address Jake's first of all and put a caveat out there. Yes, I work in mental health, but don't shoot me down if I perhaps give you some opinions that may not be exactly textbook. Body dysmorphia, for one, is incredibly rare. There may be a possibility that we see it more often in the cosmetic industry. That may be the case, but I won't actually jump in on that. And I have picked the brains of my brains trust, Andrew Frukas, and he says he doesn't necessarily believe that that's the case either. So, okay, how did this come about? Well, we know that in the instances where people who have a confirmed diagnosis of body dysmorphia, who have had cosmetic surgery, have at times become worse. So their body dysmorphia has at times become worse. Now, we're not necessarily talking about surgery here, but we are talking about cosmetic injectables or cosmetic Botox, cosmetic injectables and things like that. Now, David's point about could people actually feel better, let's just go back kind of 100 years. And Jake, you might remember this in, the back door of your mind when you probably did study psychiatry. If you think about attachment theory, now attachment theory says if you smile at a baby, what's the chances it'll smile back?
High.
Okay. If you growl or scowl at a baby, what's the chances it'll burst into tears?
High.
Fairly high. Okay. So the same thing happens when we look at ourselves in a mirror. If we look like we're angry or unhappy, the message to our own brain is we are angry or unhappy.
Yep.
Now, even though we might be saying, but I'm not, I'm looking at something that appears unhappy to me. So I would actually say, and, I wish Medicare and the powers to be were listening to this, in some cases, I actually think cosmetic treatments are as good, if not better, than a lot of psychiatric treatments in treating those kinds of conditions.
Yeah.
Because if I can look in the mirror and go, that doesn't look too bad, I'm already ahead of the game. I'm already feeling good in myself.
Yeah. I mean, anecdotally, that's what every patient will turn around and say in some way. I guess it's
not anecdotal. We can actually do functional MRIs and see that.
Yeah.
You can show an angry picture to a person and they will feel angry. They will feel upset.
Yeah.
You show a happy picture of themselves, where they feel relatively good about themselves, and we do some functional MRIs, you'll actually see positive parts of the brain light up. So it's not just anecdotal. There is good science for it.
Yeah, absolutely. And there's no secret that, let's use the word Botox, but I guess we can extend it to anti-wrinkle treatments. It's got one of the most highest satisfactions for any treatment because it makes you feel better as well as look better.
Yeah.
And all of the studies show that, patients not just rate themselves looking better, but they can't sometimes put their finger on what they mean by it, but they feel better as well. They're satisfied.
So I would, from a psychological perspective, I would say they feel better, therefore they are happier.
Yes.
And then we come back to the consultation. What actually engages people in a consultation is how they feel. We're a social species, remember. We're a social being. We want to be heard. We want to be understood. So if we feel that the person doing the consult actually hears us, actually understands us, then we're going to engage.
Absolutely.
Yeah.
You get engagement, you get a patient.
Yeah. It's true. We are social. That's how we've survived and built our societies is through collaboration and community. I mean, no individual human can survive on its own. Really,
That's right.
And we need to be building communities, and as you said, and there is this, You see this with sort of trends. People have a need to conform to society. We want to be part of the tribe. If you don't feel like you're part of the tribe, you're left out. It can have devastating effects on someone's psychology and their ability to be successful in the world.
Totally.
Yeah.
In fact, in some species, if you're not part of the tribe, you'll be killed.
Yeah.
So that's how primal that can feel. And that's why people feel bullied if they don't feel, part of the clique or part of the group.
Yeah.
There is a real fear.
Yeah. And then I guess we look at what are the societal issues or things that have happened that have caused, women to be pushed into the workforce for longer, potentially people having to work later into their life, where the aging process happens because it happens to all of us. No one can. Father Time is undefeated. You can't sort of cheat. You can't cheat the system in that respect. So we are in a situation where people have got extended careers. They are competing with people that are younger in the workforce.
Absolutely.
So it's no fault of their own that they're in this situation. Society has sort of pushed us down that path.
Society has pushed in some degree, but also women feel more confident and therefore feel more valued and want to keep working.
Yeah, true.
Yeah, and actually it's not just the workplace. If you just think about society and how it's changed, many people 40 years ago, when they were 40, looked and acted pretty mature.
Yeah.
Whereas now a 40-year-old's, well, I'm 43, you're 43. Yeah. I don't feel old, or not most days anyway. But also, our life is just, our longevity is longer. And so we want to look and feel younger longer. It's just, we've changed.
Yeah.
Absolutely.
Yeah. And so, going back to what you were saying, Nadia, about perimenopausal women, obviously particularly, but I guess men occasionally have a similar sort of thing. Mm-hmm. One of the most common reasons people come to see me, and all injectors, is that change in aesthetic, because they're just not as, they don't feel as happy when they look in the mirror as they did 5 years ago. And often that can be quite a crushing change where, everything does get saggier, drier, wrinklier, hormones changing, sex life is changing, just everything changes. And many women sort of hit a wall. So it can be physical as well as mental. Mm. Yeah.
It is, because when I do a consult, I often get people to do a DASS, so a depression and anxiety scale. And then I'll get them to bring a photo when they felt their best. Mm. And this is just, it's useful in a consult, but it's also useful just for me to collect data, because I'm a bit of a data collector. And if I'm looking at somebody who is in their 50s, 60s, not happy, and I have a look at their DASS, their depression and anxiety scales, they'll be fairly high. Then if I say to them, I want you to think back at this picture, kind of in your mind, get a mental image of where you were, what you were doing, what was going on. And on a scale of 1 to 10, what did your depression, what did your anxiety maybe feel, your stress? So I work out what their language is. What did you feel then? And they'll tell you it was much higher. And then I say to them, what do you think has changed? You're the same person. In fact, you are a more skilled, you are a more rounded person because you've got more experience. What do you think's changed? And they'll say, it's these horrible lines. And it'll nearly always be glabella. It'll be, my mouth is drooping. I've got these jowls. It'll be their aesthetic. They will never go to, it'll never be, this has changed in my life or that's changed in my life. It will be the immediate thing that they can see.
Yes.
What they can see, that's the problem. Not life was the problem and I, brought up 3 kids or, paid for the house and whatever else it was. It'll be the very thing that they see. So they come to us with a problem that they want us to fix. Mm. And that's, I think, the bit that we need to unpack.
Yeah. Well, let's go there. So, I mean, Jake and I have spoken millions of times on the podcast about training and how we skill up injectors and get them ready to go and face patients for the first time. And there's a huge amount of emphasis when it comes to clinical application. How do you treat this patient? What's the pattern for this Botox treatment? All these technical skills that we try and impart on people to be able to do these treatments safely and with good aesthetic outcomes. But I don't think people really prepare practitioners, whether they be doctors or nurses, for I guess, the psychological perspective. How do you do a consult? How do you understand what's driving these patients? And so I think that's kind of the missing link, and that's why I think a lot of injectors struggle with their consultation process, potentially with patient retention, how they deal with patients that they just aren't able to build that rapport with, because you're obviously going to have people that you connect with automatically, and then you're going to have people that you don't. And how do you how do you turn that from a sometimes into an all the time? And then we'll break these down into sections, but just sort of prelude the next pieces of the discussion. And then how do you sort of deal with things that have gone wrong when you have a conflict with a patient, when you have a complaint, when something hasn't gone according to plan? How do you deal with that and come out in a positive way? So maybe let's just start with, your thoughts on, how we're training and educating injectors, and focusing on how to prepare people for the consultation process and how they can do it in an effective way. Because if I look around the industry, some of the most successful injectors, when it comes from a business and monetary perspective, often aren't the most highly skilled clinicians. They're good, don't get me wrong. I think you have to provide good, reliable, consistent outcomes. But in terms of like the cream of the crop, in terms of their technical ability, it's not always a correlation with making the most money. So if you're able to unpack that, I think there's a lot of value there for injectors that want to understand how they can become better at the consultation process.
You're right. That's a big topic.
Yeah.
As you were describing that or introducing that, there's a book that popped into my mind, The Metaphor of Play. I don't have it on my bookshelf here, but I will send you a picture of it, and it may be useful for people. It's written by Emeritus Professor Russell Mears. He was a supervisor of mine for psychotherapy, and he talks about when we engage somebody. So, for example, right now, if we were in a room, there's three of us, okay? So we've got a triad here. And that's often how people turn up. They'll turn up with their friend, and I have no issue. I know if I'm doing, a specific treatment, no, you come on your own. But if I'm doing a consult, I'll actually suggest to people, bring a friend along. That's fine, because I want it to be a bit like play. Now, the metaphor of play is literally what he's talking about in that book is humans connect through play. As kids, we can play. We get a game, we play. Kids down the street, they all play. So there's this community. But how do adults do that? Like, how is it appropriate for adults to actually play? Therefore, how is it appropriate for adults to actually engage? Because that's all a consult is really about. It's about engagement. Now, if you can engage one person and keep that person, then you don't have to keep engaging a new patient every day to fill your book. You want, David will be able to speak to this a whole lot more. You want to keep the patients you've already invested in and keep those patients and keep them building. So my thinking about this, and others, might say something completely different. My thinking is about engagement. So in terms, if I think in terms of engagement, there's actually a fourth person in this room. If you and I, the three of us were in a room, there's the middle ground. And the middle ground might be, as kids, our cricket field or our soccer ball or whatever. It's the thing we're going to play with. So when somebody comes to me for a consult, I will literally say to them, wow, thanks for coming in today. You've taken time out of your busy schedule. I'm this, I can help you with this. What brought you here today? And so I actually want to start a game, but the game is about how do you play? What's your language? And I will try to use that language. So they'll give me some indication. They'll talk in terms of, people either talk very practically, this, that, and the other thing. So they'll talk in a very linear way, or they'll kind of be all over the place in a kind of a metaphorical way. So, it happened like this, and they'll tell you stories. So I will start to piggyback onto their language. But all I'm actually doing is creating an engagement because I want them to feel safe. I know they've come because, in the book it says they want glabella toxin, or they've got, they want crow's feet toxin. I know that that's what they think they want, And Jake did a great. It went backwards and forwards quite a bit a while ago about somebody wanting tear trots, and you made some comments about the fact that maybe that's actually not what they need. So people will come with what they think, but it's up to us to then unpack that story, and that's actually all it is. It's a story. So they think, they've been on Google or they've been on TikTok or whatever it is they've been on, and, this person's had some goddamn treatment, whether it's appropriate or not. They think that's what they want. That's not necessarily what is actually needed. But we don't know that until we start to actually engage the person. Once we engage the person, they actually start to tell us a bit about themselves. Then when they tell us a little bit about themselves, we can actually start to unpack how they're thinking.
Yeah.
Once you get that story, then you actually get a patient. You get a patient almost for life.
It's interesting. When I teach injectors, it's very similar to what you just said, but I maybe talk in different language. I tell them that You've got to be a detective.
Yes.
Just like you said, most of our patients, and this is our industry's fault, and I think we've spoken about this before, we advertise our services very black and white. Just like you said, you can come and have glabella tox or lip filler or cheek filler, and our patients inevitably come asking for those very binary sort of options because that's what we present them most of the time.
That's what we tell them.
Yeah, exactly.
That's the menu we offer them.
And yet, when they come to our clinic and they think they want, cheek filler, it's our job as the clinician to diagnose and you call it play, but I call it investigate. But same thing, right?
Sure.
We've got to work out, well, who is this person? What's motivated them to come here? What's going on beneath the surface? I've identified their perimenopausal. Are they working? Are they looking for work? Have they just got divorced? Are they in a relationship? Why are they actually here? Because no one wakes up and just arbitrarily says, I want cheek filler today. There's a reason
exactly right.
behind that.
Mm-hmm.
And it could well be some of those things that you mentioned. I feel saggy. I feel tired. I feel, let's go more extreme, I feel ugly. So something has brought that person there, and it's our job to tease that out. But it's interesting that you sort of talk about play and you encourage them to come with a friend. I understand from the mental health perspective, maybe that makes them feel more comfortable and maybe more conversive in that environment. But for me, I've decided that I actually want the patient on their own so they can actually feel more comfortable to voice why they're here without someone pressuring them to do or not do something.
Yeah.
But, either way, I guess you could argue either way. What do you think, David?
Yeah, I mean, I guess what I'm getting from what you're saying, Nadia, is that you're trying to build rapport as quickly as possible so that the patient can communicate. So, I mean, when I used to work in sales, I'm not sure you might have listened to some of these discussions that we've had, they used to teach us to do exactly what you did, which was to identify how the patient communicates, what language they're using, the speed at which they're talking, do they use a lot of body language, all those kinds of things, because we are subconsciously looking for commonalities. Because
and see, that's the word I use, play. So what you're saying, commonalities, what you're saying, Jake, as detective work, that's this, the third entity in the room.
Yeah.
I'm looking at how this person wants to connect, the social aspect in that individual. And that's what we call adult play, because we have to connect through language.
Yeah.
Yeah.
So, yeah. Keep going, David.
Yeah,
that's really great.
And I was just thinking as well in terms of what Jake was saying, people don't wake up one day and say, I want cheek filler. So I think what you're trying to say, or maybe another way of looking at it, is that you're trying to get to the causation rather than the symptom. Mm. So when we're trying to work out what is making you feel this way, it's not actually the cheek filler it's the fact that you have a self-perception issue, and that might even, whether it's imagined or whether it's real, you're feeling a certain way. So to try and get the patient to feel comfortable and relaxed, so that I kind of think that once you've got them feeling relaxed and the rapport's there, then the channels of communication then open up. Yeah, and that then is when real conversations can happen. You can get to the root cause of what is actually the reason, and they may not even be consciously aware of it when they come in.
They really are.
Yeah, yeah. So I agree with everything that you're saying, even though I'm not medical. I guess you sort of come across these types of challenges in all sort of facets of life. It's just looking at it from a different perspective.
The other little trick I've learned over the years, for whether it be a psychotherapy patient or a cosmetic patient, if they book an initial consult, I'll never see them on the same day. I want them to actually wait. Now, whether or not, I don't know whether this works in business because I wouldn't call myself a business person, but what I think it allows people to do is to start planning for that appointment that's coming up. Because I want them to start thinking about where they're going, why they're coming to me. And that'll be one of the questions I ask. You've taken time out of your busy day to come here. What do you actually want from me today? You're not going to get a treatment. Chances are you're not even going to get a product off my shelf. But what brought you here today? So I want them to start thinking about that. And I'm lucky enough to be in a position where most people can't see me the same day that they want to make the appointment. So they'll generally have a week or two from when they make the appointment to when I actually see them. And I can flick out just little bits of information to them. I'd really like you to fill this out, or I'd like you to start thinking about this, or can you bring a photo where you felt the happiest in yourself? Not the happiest in your appearance. I'm already starting to use a particular kind of language. The happiest in yourself.
Yeah.
Generally, I'll bring a picture where they're all made up and going to the prom. But so the question then is, okay, so what made you feel the best in yourself when you look at that picture? So back to your point, David, I didn't realize it was a sales technique either, because God knows I don't think I could sell anything to anybody. But I think you're right. We have to find their language in order to find out what they actually want. Now, I think when you and I were talking previously, David, we talked about, do we give up sometimes our clinical expertise in order to try to just answer the patient? The patient wants X, Y, Z. They want big lips. They want big cheeks. And do we just do that in the hope that we're going to engage people and we're going to fill our book? You know what? I don't actually think it ever happens, because I'm happier to send people away on their first consult with nothing. You're going to get information from me. That's what you've come for. That's what you've bought. And I'm going to send you away with things about how to look for ingredients, or the fact that you might be jowly down here because the fat pads have disappeared or the bony structure has disappeared. I'm going to send them away with information to think about.
Yeah.
Yeah.
And I think that's actually more valuable, because you're building a journey. You're building, I'm interested in you. I'm interested. If you've Googled something, then you're already researching. Good on you. And I'll say that to people. Good on you. You're already doing research as to how to look after yourself. Let me help you fine-tune that.
Okay. So how do we combat that in sort of practical terms? Because as Jake said, this industry has sort of grown and evolved, and it is a hybrid between sort of want-based and need-based, and it's commercialized, and you've got large businesses now buying these clinics and advertising this for that much money and, sending them offers, and we've been programmed as a society to expect instant gratification. And so it's about balancing the commercial pressures of having a business, paying your bills, being successful, versus what you're talking about and what Jake's alluding to as well is, being confident enough to push back, risking that the patient might go somewhere else. So if we can just sort of distill that down into sort of what practitioners listening to this can implement into their consultation process, or things that they might want to start considering. And maybe it's not like an immediate 180. It's about taking small steps towards slowly changing your practice or developing your skills in a certain area. So how do we, and I guess from both of you, because you're both, Nadia from a psychology perspective and you as a practical practitioner, how do we actually help people listening to this do things better and start changing the way that they're consulting without risk of losing their business or their patients and overcoming that fear?
I'll say something first, because I was just thinking about the previous answers and what you guys both said. So when I worked with you, David, in a chain clinic, that was several years ago now, it's only struck me as I've left there and sort of changed how I practice and I guess created a different patient journey.
Yes.
But many clinics and many injectors listening to this want walk-in patients because it's high volume, more money, blah, blah, blah. But if you think about it, and just like what Nadia said, that's a really tricky patient to deal with. You have no idea who they are. They've just walked in off the street. They may have literally just seen your advertised hoardings and decided, I'm going to go in and get lips today.
Yeah.
That's actually the trickiest patient to treat because you have no idea about who they are, why they're there. And, your risk of maybe not getting it wrong sort of technically, but not understanding the patient, the risk of a complaint or not getting it right is higher than someone who, like Nadia said, you've sort of taken a bit of time to get to know, or you've sent some pre-consult forms and got a bit of feedback from them, or they've just had a chance to think about it for a week. Mm-hmm. So if you think about it logically, walk-in patients, you might have thought that they're good for your business, but they're actually very tricky. Mm-hmm. So maybe think about, if you do own a clinic and you have the ability to mold the patient journey in some way, just like Nadia said, maybe think about not allowing patients to walk in, or maybe you allow them to walk in, but it's very clear that they can't be treated on the same day. That's a good ring fencing thing that Nadia touched on. And if patients know that they're not going to get treated, but they still want to come, that's quite a good patient because they're pretty involved in the process and they're quite engaged and they're serious. Yeah.
Just to cut you off 1 second, maybe a strategy to further build demand for you and your business is I'm booked out, even if you're not.
Yeah.
Sorry. Everyone wants to get into the nightclub they can't get into with a line out the front, right? So, sorry, continue. I just thought I'd throw that in.
No, it's good. Look, with my booking system, it's just, I guess I have the ability to, when someone does book in, and it tends to be a few days, a week, or even a few months in advance, I can send them some information and I can criticize myself for maybe being a bit overboard, but I get a lot of information from them. And, I get the odd patient who grumbles about it, but they all do it because they have to do it. And then even before I've met them, I've got a pretty damn good idea of who's coming from obviously, medical history and so on, but their skin history, dental history, psychological history, and so on. And very occasionally, it will prompt me to reach out before I've met them to get some more questions or some more answers or to probe, because I really want to make sure that patient who comes is, obviously sound and medically fit, but also mentally fit. And isn't going to be a problem either for me, but also for themselves. Very occasionally, patients come thinking they need something, and you do everything in the best of your power to please them, and it's just never going to work. And it isn't just the obvious things like BDD, but sometimes you just get a whiff of this isn't going to work well, and I can't put my finger on why. So sometimes I just need more information, or I'll just introduce myself and tell them a bit more about how things work, or the pricing, or just I don't know. Sometimes you just get that sixth sense that some more information is needed, and I think that's really saved my bacon a lot of times. But I know that doesn't work for everyone, and it depends what clinic you work in. But be the detective or be that playful sort of information gatherer where you just go the extra mile to try and suss people out if you can before you've met them. That would sort of be a good takeaway for me because I've learned a lot about that. What do you think, Nadia?
I couldn't agree more, and I was just wondering there from David's perspective in mentoring and building businesses, David, do you have a sense of whether you get I look for patients that I'm going to have for a long time. I really am not big on patients that walk in the door because I know they're going to walk in somebody else's door in 5 minutes' time. So I find that I do better with patients that I know I'm going to probably keep for a long period of time. And the more I push back, the more I say no, the more they actually want. Now, yes, and I know a lot of people starting out in business might go, that's too risky. I don't want to say no to a patient. But I think, like Jake's saying, the more you can actually get to know the patient or the more information you can get about what they actually want, the more you can meet their need. And you might be able to do all of that on day one. And if you are seeing people that are coming straight off the street just because your door is open, then I kind of wonder about that motivation. Are they looking for just a quick fix? Well, go and buy a cup of coffee. Generally for me, quick fix is a cup of coffee. I want a journey. I want a patient on a journey. What we're doing is medicine. Now, I know it's been kind of touted as, kind of, I don't know how it's been touted. It's kind of been morphed out of medicine into something that is, a bit too Hollywood for me. But I think at the end of the day, do you go to your surgeon and get your surgery the same day? No. Do you go to a cardiologist and get everything done the same day? No. It's the same thing. Cosmetics is about helping you to feel the best you possibly can in whatever journey you're in right now. And I can't achieve that in the first 30 seconds.
Yeah.
Yeah.
I might be able to shove some neurotoxin in your face, but I can jolly well guarantee that's not going to make you walk out the door feeling better.
So if we sort of put this into commercial terms, because that's always the balancing act, right? Because this is a need-based area of medicine. It's not like it's a want-based, not a need-based. So the challenge that a lot of people have is that they've got the commercial pressures of having a business. And so perhaps the best way to look at this is to map out how long it's going to take you if you do things the correct way, the way that we're talking about here, taking your time, being selective with your patients, really getting to understand them, being happy not to deal with same-day walk-in patients and doing treatments, and actually plan for what is normal in business, because we've been very spoiled in this industry. And I think in some ways this has created a rod for our own back, because we've been trained to think you can open up a clinic and you'll have patients straight away and you'll be successful in a couple of years and giddy up, let's go. That's not the reality of businesses. Most businesses do not make money for the first 2 to 3 years in terms of profit. And so I think that a lot of the problems that people run into is that they are not prepared from a commercial perspective. They don't understand business at all. And they open up their doors, they spend money on devices, on a fit out, commit to a lease, and then they put themselves in a situation that they can't get out of. And then you start to compromise on what you should be doing for the patient, what's best for the patient, and what's actually best for you as that practitioner. So my advice to all of my consulting clients is you need to be prepared for a 2 to 3 year journey before you start making money. And putting yourself in a situation where you're able to do that. So maybe it's not about opening up your own business straight away. Maybe it's working for someone else, identifying a mentor, having another job on the side that is providing you with income so you do not have that overwhelming pressure on you to make a lot of money from your cosmetic practice, because it's going to be a long journey to get there. And so I think, starting with the right information and understanding how to navigate those commercial pressures and alleviating them will then allow you to make sensible clinical decisions for your patients and actually build the patients that you want. A lot of people will just say yes to everybody, and then they start hating their life. They hate the patients that they're seeing. They're not passionate about it anymore. They're questioning why they even got into this industry. Because if you're seeing people every day that you don't like, you don't connect with, you're doing things that go against your grain or against your medical ethics, then what are you doing? And so I think it's about starting with a realistic picture of how long it's going to take you to be successful and putting the strategies and the plan in place that will allow you to get there. So you do it in a sensible, considered way. You're doing the best things by the patients. You're not compromising or putting yourself in a vulnerable situation financially. So my advice is slow down, think about how you're going to survive with not a huge amount of income coming from this business, and build a strategy that's going to allow you to do it in a way that is responsible and but as it both medically and commercially.
Can I build on that? I know that you obviously drill down on financials and business for your mentees, but do you guys also, or I'm assuming you also advise them to, you just said it, who is your dream customer?
Yeah.
And if you can very clearly identify what that means to you, who do you want and what services you're going to do? Because one of the common mistakes I think people do is they just replicate every other clinic model that's out there. Yeah. And they don't even know why they're doing it. They just set up and copy and paste somewhere else.
Most people do what most people do.
Yeah. and that is the problem, because then they're sort of just rehashing old mistakes. So if you could sort of really think about, well, what is that patient journey? We've just discussed what it might be like in a gold standard way. So don't ever go down the walk-in way. Make it impossible and change it to some other practice.
Yeah. Yeah.
So just my other thoughts on that.
What do you think, Nadia? A bit to unpack there.
There is. And you know what I would say, Jake, is I don't necessarily know when we're starting out that we know what our dream patient is. But you know what I would say is, what is your dream skill? What is your best skill? What is the thing that you love and you do really well? And then I think if you start to build on that and you get really, really good results. So when I started out, I knew I was never going to inject.
Yeah.
You know, I had a bit of a go at it, did the weekend courses, you know, went here, went there, did a bit of mentoring and thought, you know what? You know, these proportions, you know, I got my little protractor or whatever the damn thing's called. It's still not, this is not me. But what I actually love, I love doing consults.
Yeah.
So I'm happy doing the consults and then saying, okay, let me hand you over to Dr. Walsh for this, that, and the other thing. Let me feel very comfortable with a really close-knit team that I can work with and be very sure that we get you to where you want to be.
Yeah.
So my dream person or my dream patient is the patient that's happy for me to say, no, I'm not the person for this, but if I'm understanding you correctly, David said there's a want rather than a need basis. I'd actually say it's the other way around. People need to feel good all the time.
Yep.
So you might be able to give them what they want in the moment, but that's not what they actually need. They need to feel good. So the only way to feel good is actually be on a journey.
Yeah.
And I think I hear Jake talk about this all the time in his posts. It's the journey. Now, the only way we can develop a journey with a patient is if we know the patient. You can't develop a journey with somebody who walks in off the street.
Yeah.
You only get to build a journey with them when you get to know the person. So from my perspective, it's about getting to know them and then getting other people involved. It might be Ron Kleiner, because these are the people that just come to my practice. But get the people that you work ethically with. Get the people that you feel confident with. You know, so-and-so does really great whatever, you know, and they're attached to our clinic, or I'm happy to refer you, make a referral. I think this is how we build safety for patients, safety for ourselves, and that's a big issue. After 40 years, I can tell you, being able to sleep safe at night and, you know, not worrying about what in God's name is, you know, my staff member doing, how did they burn that person with a laser, what's going on, getting really good people around you. And I think, you know, to add to what you were saying, David, mentors, getting a great accountant, getting people that have run really successful businesses, getting all of those things in place, first of all, getting great mentors. I'll go and bother people that right now my thing is PRP or autologous plasmas. I'm shameless enough to go and, you know, knock on the door of people like Matt Murphy at, you know, the New York Stem Cell Society and go, I'd like to really learn from you. I want to know more about this. And they kind of look at you a little bit crazy to start with. But eventually, you know, they're really generous with their knowledge. Most people who are good at what they do are generous with their knowledge, and they will become great mentors.
Yeah. I'd give one tip for the people listening, and this goes for clinic owners as well as injectors, because I sometimes think there's a bit of a disconnect between the clinic owners who might not be medical and obviously the injectors. And it's sort of, I guess it gets to the crux of what we've been talking about. For new patients, I think it's a lot easier to have one offering. Just offer a consultation. Don't call it toxin, filler, bioremodeler. Just call it consultation for new patient and give them an hour, 60 minutes. That means that there's no pressure to do anything because you haven't labeled it. Patient is maybe more happy because they realize you're not selling them anything particular. You're diagnosing, you're being the investigator. It means that you've got time with that patient. So, you know, whether it's complex or easy, you're not scrambling. You can get your notes done and all that kind of logistical stuff. But more so, it allows you to plan that journey. And you be very deliberate in that. You say to your patient, well, we've got 60 minutes today, but obviously we're not going to cover everything off your checklist. So let's, you know, talk. Let's just have a free conversation. And I think that that's a good way of injectors maybe respinning things rather than advertising lips, cheeks, jawline, because it sort of ring fences you to do something. It handcuffs you. Whereas if you make it a little bit more generic with a bit more time, and you advertise it that, we'll just see what you need on the day. We'll work it out. I think it takes the pressure off. Have you tried that in your clinics?
Yeah, I mean, in the chain clinics that I was involved in, it was difficult to do that. And that's kind of part of the problem. I'm not here to say anything, chain clinics have a place in the market, but, it's difficult to argue that they haven't commercialized these treatments and created a pressure for everyone involved in the industry to sort of follow suit because they've become so powerful and dominant.
Yeah.
And also it has programmed patients to think and expect certain things.
Yeah.
So I think what you're saying is important because those sorts of barriers start to then create a filtration system for you to potentially discourage the patients that aren't in line with the way that you wish to function as a practitioner to come into your practice. So I think it's almost like a first step in pushing away those patients who are going to expect the treatment to be done the way that they want to do it and the time they want to do it and not really be too bothered about your input. You're just there as a mechanic.
Monkey.
Yeah, basically a mechanic just sort of treating an issue without actually diagnosing the problem or understanding things holistically. So I think that's a great first step.
Yeah, and I think you should build that into your marketing, your advertising, your social media to tell people that's how I work, that's how we do things, because then you'll attract those people who will resonate with it.
Yeah.
And you'll push away the people who just want
And this is why planning's so important. It's not just about planning your treatment, it's about planning your entire business. So if you know that, as you said, it's a 2 to 3 year journey, identify what sort of patients you want, what sort of injector you're going to be, who your mentors are. You financially got a backup plan so that you're not feeling that pressure to sort of draw in, maximum dollar from every patient that comes in.
Yeah.
And just focus on what it is that drove you towards this industry in the first place. Are you here because you genuinely love helping patients and performing aesthetic treatments? The money will come as a byproduct. If you do, money follows success. If you're successful at what you do, the money will just happen. And success comes from getting up every day, doing what you love, being genuine about it. And the rest kind of takes care of itself. So I think a lot of people start with the wrong motivation or chasing the wrong. It's like a mirage. It'll continue to elude you if you try and chase it, I think. What do you think, Nadia?
I think you're totally, absolutely right. Couldn't agree more. When you say can you commercialise initial consults? Why can't we commercialise initial consults? They're buying our knowledge.
Yes.
I charge for consults, for initial consults, and they know they're not going to get a treatment.
Well,
they'd be lucky to walk out. They might walk out with a sunblock,
Yeah.
And we would have played. We would have played with their skin and put one sunblock on one side of their face and put another one on the other side of their face, and their eyes are burning on that one. Well, that's not the one for you. Or they've gone home with a sample of 4, see which one fits under your makeup. I call that play, and I'm looking at how they're treating their skin, how they're, and when they relax, well, what was it that you came today about? Oh, it was these lines. Oh, and are they still important to you? Actually, no. You mentioned that we're going to start here. Can you book me in and we're going to start this journey? When can I start my journey? So I think we do commercialise our initial consults, and that's how you then create longevity with patients. They want to be on the journey. They don't want to feel good just today. They want to feel good forever.
Yeah, so we've done that to ourselves. We give consults away for free or give them, and so we've actually told our patients that our knowledge is not valuable because the consults are free, or you pay a $50 deposit and it comes off your treatment. So actually, this is part of the problem. We've actually created the problem for ourselves because we've told patients our knowledge ain't worth shit because it's free.
No.
Walk in and anytime you like.
Yeah. It's like buying a hamburger.
Yeah. Well, literally. I mean, what do you say to those listeners? Because I know commercially and the inexperienced injectors, they find that very hard to reconcile. They feel almost embarrassed or ashamed to ask people for money for their time and their wisdom. They, it seems so crazy now because I'm experienced, but I remember being in that position. Yeah. So, Nadia, what do you say to those people listening who still do free consults and don't value their time?
What are you telling your patients? What are you actually telling your patients? You're telling them, don't trust me because I've got nothing valuable to tell you.
Mm-hmm.
Yeah.
Is that really the message that you want to send your patient? No. You want to send your patient the message, you can trust me because I have done a lot of work to get past Google. I can help you with managing Google, but what you're actually buying is my knowledge.
Yeah. And by the way, if you are inexperienced, you still have knowledge.
Yeah.
You know.
Oh my God, yeah. Absolutely.
You know, you might be offering a basic service, but you are still looking after your patient within that scope of practice. So never devalue yourself.
And if the patients aren't prepared to pay for that, then that's all you probably need to know, that they don't value your
Is that the right patient for you? If they don't value your knowledge or value your time, then are really they the right person for you?
Yeah.
100%.
The other thing I think that people kind of might miss, and this might be I'm a bit like Jake, and I'm a bit OCD with having to do things I have to do things my way. It's kind of my way or the highway, and that's maybe good or maybe bad, I don't know. But in the morning, I send out a message to everyone that I've done big treatments on the day before. And I just want to know, hi, put the name in. Hi, just checking in how you're feeling today. How's your skin looking? What's going on? You had a treatment with Dr. Walsh yesterday. You won't expect anything from your neurotoxin today, but is everything going okay? I don't want to know in 6 days' time or in a week's time that the wheels have fallen off. I want to know now. And we talked about this earlier. How do we get out of? Don't get into conflicts. Kind of avoid them before they even start. Don't have them knocking on your door that you actually have to think about conflict resolution. Hedge it off before it even gets there. The best way to do that is be ahead of the curve. And being ahead of the curve is it takes 30 seconds to automate a message to your previous patients. And if you've got a relationship with those patients, they'll send back and say, oh, thanks for checking in with me. Yeah, everything's great. Or, no, look, I've got this big bruise. Is it okay? I want to know those things before they become, an infection or before they become an occlusion. I want to know.
It's a really good point. I think what you're also saying is, from the patient's perspective, they realize you care. They've given you this money, but you've actually reached out after that transaction and you're still caring about them.
I even message people after a consult, my initial consult. I'll actually message them and say, we had a lot of time yesterday. We covered a lot of topics. I know that you wouldn't have been able to remember everything, but I sent you information. Do you have any questions that we can follow up on?
Yeah.
And they thank me for that. But that's part of the journey. And I'm also teaching them how I work.
Yeah.
So each time you come in, you're going to get photos taken. Each time you come in, you're going to have to sign a consent form for whatever we're doing. There's going to be patient education at the end of it. I want to be part of this journey with you. And that's what we're selling, I think.
Yeah.
We're not just selling the injection that we do.
Totally agree. But how do we deal with the patients that we do all those things, but there's an issue? Just say, for example, I don't know, they're not happy with you. So the swelling's gone down. It's 2 weeks later. You've sent the message. They said everything was fine at the time, but things, for whatever reason, they're not happy and there is a conflict. So,
okay, is there a conflict? Is there a conflict, or do we just need to get more information? So I would say bring them back in and do a review. I don't charge for reviews. That's one of the few things that I don't charge for, because I see reviews as hedging off a problem. So if I want somebody to come in, I'll say to them, look, I can hear that you're unhappy. You've sent me photos. Yep, I can see what's going on there, but I'd actually like to see you in person. So I will then be thinking about, what did I tell this person was the post-care, and where could they have stuffed that up? Or did I not explain it well enough for them to be able to follow my instructions? So generally it's about, what am I doing that hasn't helped? And I will actually ask them that. Okay, so take me back to when day one we did such and such. Then what did you do when you went home? And God knows, the dropped eyebrow. Oh, I had a massage after I had my neurotoxin. Oh, you had a massage, face down massage. There we go. So I didn't actually educate that person well enough, did I? That's my fault. Is there a conflict? No, it's a learning point. I didn't actually educate that person well enough, or I didn't explain and emphasize what I really needed them to hear. And so I try to turn it around the other way. Is it a conflict, or is it something that we can both learn from? And you'll disarm them fairly quickly that way. Okay, so this is what we talked about. This is what we're going to do next time. However, if I do a treatment and I think the result's crap, and I've said, yeah, you're going to have to pay for, 8 to 10 treatments or 3 or 4 treatments, and we get to the end of 3 or 4 treatments and I'm thinking to myself, this is just not what I would be happy with, then I might say to them, look, I agree with you. I'm not happy with the outcome either. I would like you to come back and I would do this treatment again at my own cost. So you make judgment calls along the way. You get better at knowing, yeah, it should look like this. Someone's skin should look like this by the time we've done X number of whatever. Or, okay, that treatment didn't work. I'm not happy with it. You're not happy with it. How do we make this better together? And how do we learn from it together?
Can I ask, Nadia, it's a really good point. None of our treatments are guaranteed.
Nothing in life's guaranteed.
Nothing's in life's guaranteed, but particularly when you're trying to tap into someone's mindset that you're treating and you don't know what their expectations are truly. You think you know because you've had that conversation and a good consult, you've done the photos, blah, blah, blah. But, 1% of the time you do get that tricky patient or just that patient that they didn't get a good result and you can see it and you agree with them. But pre-treatment, do you have a explicit chat about that? Do you say
yes.
there are no
because
guarantees?
I will say there are no free treatments.
Right.
So there are no free treatments. Generally, I'll have to drill down in what's gone wrong.
Mm-hmm.
And when we know what's gone wrong, and sometimes it will be they haven't given me all the information because I haven't asked all the questions I needed to ask. So I've got to drill down a little bit more.
Yeah.
Generally, I will say that there are no free treatments. In the rare cases where I have done something, it's because I've possibly tweaked my protocol slightly. I know I've done something that, was slightly maybe experimental on my part, and I'm actually not happy. Or I genuinely said to that person, look, I think you're going to need 6 or 7 of these treatments. However, we may need more. And so I'll always say that to them. And that's part of the consult. That's part of the consent. The consent will say there is no guarantee here. I'm recommending that we do X number of treatments and then we review. Now, when we review, I'll do a Visio consult, a Visio camera. I'll have all the photographs and I'll shove them on 2 screens. God knows somebody set the 2 screens up for me because I can't even log on to a Zoom meeting. But I want to be able to work with the patient. Do you think this is actually looking better, or do you think, we can go a bit further? Is this where you want to be? Yeah. So I'm always putting it back to them. They're making the choice. This is what's happened after 3 treatments. We've given it a good enough time or a long enough time to see a result. Is this where we want to be, or do you think we want to be a little bit better? And I'll always say to people, patients will say, how much better do you think something's going to get? Do you think I'm going to get a 50% improvement? Do you think I'm going to get an 80% improvement? I'll say to them, it's really hard to know because everyone, especially as we age, our repair rate slows down. But this is what I'm going to recommend first of all, and then we're going to review it.
Yeah.
Now, when I say a moment ago, I will do a free treatment, it will generally be if I'm playing with a protocol, and I'll be upfront and tell that person, look, I'm trying this out. I don't know whether it's going to work, but if it doesn't, I'm happy to kind of wear the cost and fix that again.
Yeah, and document those conversations.
Oh, boy.
From a cosmetic perspective, I know you do mental health as well, but it's in our new regulations that we have to have financial consent. Yeah. So you need all of those generic,
absolutely,
common things on your consent form. Yeah. So there's no sort of misunderstanding.
Yeah.
We actually send out a book. We have a patient information book. So, and we also use a 2-way texting system. we use it in mental health, because mental health, we do a lot of medico-legal work, but I've moved it over to the cosmetic practice as well, where very few things are done verbally. Everything is written. Everything is written in some form where it can be uploaded to their notes.
Yeah.
So it doesn't matter if, you think you booked an appointment. It's something as simple as you booked an appointment and didn't confirm. Well, I'm sorry, you don't have an appointment. You didn't confirm, and there's no record of you ever confirming.
Yeah. So very, very, very interesting educational discussion. I think a lot of people can take home some advice and implement it into their practice or tweak what they're doing. Maybe can we just distill it down into some key points for people to sort of, like a summary, I guess, because we went down a few rabbit holes. So maybe just to sort of bring it back and into some condensed points. What do you think?
Well, I think Nadia and we touched on trying to suss out who's in your room and make it as fun, enjoyable, playful. Nadia sort of mentioned, and sometimes that works, sometimes that doesn't work. Sometimes it's got to be more formal, and so you've got to suss out their personality and their language and body language. If you do have the facility, try and do some information gathering before they've come.
Yeah.
So that will give you a bit of a flavour of what you're dealing with. And then you touched on wants versus needs.
Yep.
That's a big thing for me.
Yeah.
I almost fall back on it on every consultation, because patients don't know what they need or want, but I try and crystallize that for them.
Yeah.
You come here with a want, but sometimes there's a need, and sometimes we have to go backwards on what you came here for.
Yeah.
Next,
yeah. Well, I mean, I guess, commercially set yourself up for a 2 to 3 year plan and be of the understanding and be prepared for the fact that you might not make money for a little while. And so you never want the commercial pressures to compromise your decisions as a clinician. So proper planning, expectations, being in the industry and doing what you're doing for the right reasons. I know there are a lot of people that have come into this industry because they've been lured by money, and this has been a very lucrative industry. And I think that, people that potentially are in that position that are not that happy with what they're doing maybe need to reconsider if this is the right job for them, if this is what they're really passionate about. Absolutely. Anything to add to that, Nadia, that you think we've missed or you want to tack on to that?
I think there's so many things that we can keep going on, but I think the thing that you've both mentioned, David, you mentioned being prepared to build.
Yeah.
I think I can't emphasize that enough. Practices take a long time. I'm talking 40 years that I can look over and see the metaphors, the metamorphosis rather of how my practice and my businesses have changed.
Yeah.
You've got to give it time. Jake, you mentioned about being prepared to be on part of a journey, finding the patient's language, finding what they really want. I can't emphasize that enough. And I think we need to find a way to formally teach people how to do a consultation. I guess I'm lucky from a psychiatric perspective that we have a very formalized consultation process. Be consistent, I guess, is the thing I would say. Start out the way you want to end. If you want to be successful, then you've got to start being successful to start with. Be slow, be consistent. And like Jake said, just get to know the person as much as you can before you start doing anything.
100%. Well, we could have gone on for hours, I'm sure. Maybe we'll do another one in 12 months' time and sort of rehash this. But Nadia, thank you so much for joining us. It was a fairly last minute scramble to get this planned, but I thought that went really well. I really enjoyed it.
Sometimes the best outcomes are as a result of spur of the moment and spontaneity. And I think this is a great way to start 2024 without sort of talking about technical application of technique, is getting into the right psychology, starting off with the right mindset, and potentially just taking a few things that we've said from this discussion and implementing it into your practice and seeing how it goes for you in 2024.
Awesome.
Thank you so much for inviting me along.
It's our pleasure. Nice to see you in face-to-face, even if it wasn't in person.
Yeah. And just before we let you go, is anything you want to talk about in terms of our Patreon? I mean, it's a big part of what we're doing. We're trying to grow that community. I think that, there are a lot of practitioners out there in the ether who are on their own. They don't know where to go, who to turn to for support and mentorship. So, I mean, without putting words in your mouth, is anything that you can tell us about the Patreon and sort of what you think of the community?
You don't need to put any words in my mouth. I am such an advocate of it because I think it is a platform, and you guys have gone, you've built a brilliant platform. People want support. this is the platform to get that support. You know, if you want information from people around the world, this platform is where you're going to get it. Join the platform, throw ideas out there. You're going to get people to help you. And that's what you need in the industry. You need help. You can't do it alone.
Thank you, Nadia. Appreciate that.
Very, very kind of you. Thank you very much. Well, we look forward to seeing your continued input in the WhatsApp groups, and obviously we'll continue to chat and love to catch up for a coffee in person one day if you make it down to Sydney soon. I know you were down in Berrima a few weeks ago, so you just came past the doorstep. So let us know when you're coming by and let's catch up.
Awesome. And guys, if you are interested, obviously the
Yes.
details for Patreon and everything else we do are in the podcast description.
Awesome.
Take care, Nadia. See you later.
Bye.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.